If you regularly eat one particular food, you can ensure you maintain healthy B12 levels. Many health issues stem from a lack of specific vitamins or minerals. Serious conditions like high blood pressure, eczema, depression, and low sperm count can be caused by a single vitamin deficiency. Correcting the deficiency can resolve the issue. This video will discuss 5 common vitamin and mineral deficiencies and how to address them naturally. Let's begin. Vitamin D deficiency is highly prevalent among Indians, with surveys suggesting that about 75% have below normal levels. Vitamin D is crucial. A deficiency can weaken bones and muscles. Some people who eat well and sleep adequately may still experience fatigue due to low vitamin D levels. Fatigue is a primary symptom. Joint pain and muscle cramps can also indicate a vitamin D deficiency. Low vitamin D levels can also weaken your immune system. Vitamin D is also essential for calcium absorption. Taking calcium supplements may not be effective if you are deficient in vitamin D. Finally, a lack of vitamin D can negatively impact your mental well-being. If you are easily irritated or experience unexplained mood swings, consider checking your vitamin D levels with a simple and affordable blood test, around 400 to 500 rupees. It might seem surprising to have a deficiency in a sunny country like India, but our skin produces vitamin D from sunlight exposure, and many of us don't get enough sun. We spend more time indoors and use sunscreen when we do go out. Is sunlight really an effective source of vitamin D? Studies confirm that it is. Research shows that in summer, exposing about 25% of your body to sunlight for just 8 to 10 minutes daily can prevent deficiency. However, in winter, when only about 10% of your body is exposed, you might need up to 2 hours of sunlight to meet your vitamin D needs. This explains why vitamin D deficiency is more common in winter. Getting 2 hours of sunlight daily can be difficult. Ayurveda suggests that exposing your navel and back to the sun can help your body produce vitamin D more quickly. If you are concerned about tanning, consider using a head umbrella, around 250 rupees, to shield your face while exposing the rest of your body to the sun. Another reason for widespread vitamin D deficiency is the limited availability of vitamin D rich foods. Mushrooms are an option, but simply eating them won't significantly boost your levels. Exposing mushrooms to sunlight for an hour can increase their vitamin D content by 1000 international units. Exposing them for 14 hours can increase it to 267,000 international units. To increase your vitamin D intake, eat mushrooms that have been sun exposed for at least an hour before cooking. Note, however, that you still need supplements to reach those levels. The amount of vitamin D created depends heavily on how strong the sun is, and sun-exposed mushrooms contain a weaker form of vitamin D than supplements. It's difficult to get enough vitamin D from food alone, so supplements are often recommended. There are two main types: allopathic tablets containing 20,000 to 60,000 international units of vitamin D, and vegan D3 supplements with 600 to 1,000 IU. For quick results in cases of severe deficiency, a doctor may advise taking the higher dose allopathic supplements for a month, followed by a break. Plant-based supplements, while having no side effects, require daily consumption for a longer period to raise vitamin D levels. It's best to get your vitamin D levels tested to determine the appropriate dosage. High dosage of vitamin D can sometimes lead to calcium deposits in the body. To prevent this, it's important to also consume vitamin K, which is often added to vitamin D3 supplements. Besides cold-pressed oils, good sources of vitamin K include green leafy vegetables and dried figs. Vitamin B12 is vital for red blood cell production, DNA synthesis, and brain and nerve function. Doctors often test B12 levels in patients experiencing mood swings, depression, or anxiety. B12 also helps convert food into energy, so deficiency can cause fatigue even with a healthy diet. In India, over 47% of people are deficient in vitamin B12. Ideal levels range from 200 to 950. Levels below 150 can cause fatigue, mood swings, and potentially trigger autoimmune diseases. This can be due to insufficient intake of B12-rich foods, which is common among vegetarians, or poor absorption due to a lack of beneficial gut bacteria. Even those eating a balanced diet, including meat, may become deficient if they frequently experience gas, acidity, or use antacids regularly. There is a connection between diabetes and vitamin B12. Metformin, a common diabetes medication, can hinder B12 absorption. However, B12 deficiency is primarily due to diet, not water. RO water might contribute to B12 deficiency in two ways. It lacks minerals like cobalt, a key component of B12, and it's devoid of beneficial bacteria crucial for B12 production. Strong gut bacteria produce B12, so vegetarians should consume fermented food like idli, dosa, or homemade pickles. Milk and curd are also beneficial. Milk provides 50% of your daily B12 needs, and curd contain both B12 and good bacteria. Regular consumption of moringa leaves can help maintain B12 levels. Include fresh or dried moringa leaves in your meals like dal or roti. Vegan supplements containing moringa and wheat grass are also available. Zinc deficiency is widespread in India, often caused by processed foods. It can lead to various health issues, including hair loss, slow wound healing, and sexual health problems. Zinc is crucial for testosterone production, so doctors often recommend zinc-rich foods for issues like erectile dysfunction. To prevent deficiency, prioritize whole foods like grains, pulses, nuts, fruits, vegetables, and dairy. Soaking lentils, rice, and dry fruits before consumption is essential. This removes anti-nutrients that hinder mineral absorption, especially zinc. Unless prescribed by a doctor, zinc supplementation is generally unnecessary, as excessive intake can cause health problems. Let's talk about folate, also known as vitamin B9. Surprisingly, about 35% of people in India don't get enough folate. Mouth ulcers can be a sign of folate deficiency, along with weakness, a red tongue, or yellowish skin. Folate is crucial for repairing cells and DNA and creating new blood cells. Pregnant women are often advised to take folic acid supplements to help prevent brain and spinal cord issues in their babies. Folate deficiency is mainly caused by a poor diet or not eating a variety of foods. Experts say that eating a range of seasonal dals, grains, and vegetables makes it very unlikely you will become deficient. Good source of folate include green leafy vegetables, beetroot, citrus fruits, bananas, and papaya. Now let's discuss magnesium. It plays over 300 roles in the body, with a key one being heart health. Magnesium helps keep blood arteries relaxed for easy blood flow and maintains a regular heartbeat. Magnesium deficiency is a common factor in over 80% of heart attack cases. Symptoms of low magnesium include frequent cramps, morning muscle stiffness, a stiff neck, back pain, and high blood pressure. Drinking a lot of alcohol, tea, coffee, or cold drinks, all diuretics, can cause you to lose magnesium through urine. Also, regularly taking synthetic calcium tablets can lead to clogged arteries. To prevent magnesium deficiency, cut back on diuretics and eat plenty of green fruits and vegetables. The green color indicates the presence of magnesium. Good sources include green leafy vegetables, beans, capsicum, cucumber, bottle gourd, pumpkin seeds, sesame seeds, nuts, bananas, bajra, and little millet. In general, your food choices are key. Eating fresh, healthy, home-cooked meals and avoiding junk food can greatly reduce your risk of vitamin and mineral deficiencies.